All right, ladies and gentlemen, here's our next video, and this is going to be on the back, bony landmarks of the back and the muscle attachments. So over here we have a diagram of the back, as you can see, and I'm just going to quickly give you a little bit of a more zoomed out view so you can appreciate the whole thing, okay? So here's the back. All right, we have the scapula right here. We have the humerus right here. We have the sacrum with the innominate bone on this side, okay? And one of the main things I want to bring your attention to, the first things I want to bring your attention to is going to be the skull. So the skull over here is going to have a bony protuberance right here on the midline. Let's zoom into that so you can see it a bit better. Okay, so right here, we're going to see this protuberance that is sticking out, and this is placed on the occipital bone of the skull. Okay, the occipital bone is the most posteriorly located bone of the skull, all right, of the cranium. So this right here is known as a protuberance that is external to the occipital bone. So therefore, we're going to call this the external occipital protuberance. Okay, that's the external occipital protuberance. That's what we see right there. Okay. All right. So external occipital protuberance. And then what we're going to see is that coming off of that protuberance, coming out laterally from that protuberance, there's going to be a line. Okay, this little line right here. And that line is called the superior nuchal line. Okay, this is superior nuchal line. All right, and both the external occipital protuberance and the superior nuchal line are going to serve as attachment sites for a very large muscle that we're going to see here in the upper back. Okay, and the next thing I want to point your attention to is this right here. Okay, so that right there is a bony process that is directly posterior and inferior to your ear, and this is known as the mastoid process. Okay, that is the mastoid process. Okay, beautiful. Then we're going to have these vertebrae right here. And so the first one, the top one, the uppermost vertebra is obviously going to be C1, the first cervical vertebra, and then the next one below that is going to be C2. Okay, and I put that there so you can have a reference point. All right, C1 and C2. Then we're going to see these two vertebrae over here. And as we saw in the previous video of the anterior thorax, we know that the first rib is going to articulate with the first thoracic vertebra right there. So this one right here must be T1. This must be T1, which means that this vertebra right here is C7. Okay, C7. Then if we count from here, we go T1, T2, T3, T4. Okay, T4. Now, why is it that I highlighted T4? Why is it that we labeled that? So notice that T4 is at the same level as the root of the scapular spine. Okay, remember this is the scapular spine right here. T4 is at the same level of the root as the scapular spine. And you're going to see once we start adding the muscles here, why that is a useful landmark to know. Okay, so that's the root of the scapular spine. And then we're going to do some review of the scapula right now. So this one right here, this border is going to be our medial border of the scapula. This down here is going to be our inferior angle of the scapula. This up here, right, this is the bony process that comes off the scapular spine that is known as our acromion. Okay, and this obviously is our scapular spine. This is our clavicle, and this up here is the superior angle. Okay, for completion's sake, I'll put right here the scapular spine. Okay, boom. So those are all the landmarks that we have on the scapula, and these are going to serve as attachment sites for muscles on the back. Okay, as we're going to see. And then down here, we go to the lower part of the back, and we see that the last rib 12, is going to be articulating with T12. And then we're going to have the first lumbar vertebra, L1. And then the last lumbar vertebra, so this L1, L2, L3, L4, L5. which articulates directly with the sacrum. So this right here is our sacrum, and this down here is our coccyx. Okay, then we're going to see these bony landmarks on the innominate bone, on the right innominate bone in this case. And then this right here is a large crest that is on the part of the innominate bone that is known as the ilium. Okay, if you need a further breakdown on the innominate bone, I have a whole entire separate video outside of this series that just talks about the innominate bone in detail. So we're going to link that here. This right here is the iliac crest. And then back here we have two spines, and these are the terminations of the iliac crest. So this more superior one, right, is the posterior superior iliac spine, all right, also known as the PSIS. And then this right here is just going to be the same thing but inferior. So this is going to be your posterior inferior iliac spine. Okay. And likewise, as we have posterior superior and posterior inferior iliac spines, we also have an anterior superior iliac spine, which is this mark right here, this termination of the iliac crest on the anterior aspect. And then we also have an anterior inferior iliac spine, which would be this one right here. Okay. They're not highlighted on this diagram because they're not involved in attachments for the back muscles. Okay, so they're not included in this diagram. All right, so those are all the bony landmarks that you need to know for the back and the muscles that attach to them. Now we're going to go through the muscles layer by layer, and the first muscle we're going to talk about is the rhomboid major. The rhomboid major. Okay, now the rhomboid major is going to attach onto the scapula. Okay, and from the scapula, it's going to insert onto the spinous processes of vertebra T2 through T5. Okay, and the spinous processes are these projections off the vertebra that project directly posteriorly, directly towards us in this image, right? So right here is one spinous process, the next spinous process, the next spinous process. And the rhomboid major is specifically coming from the medial border of the scapula. Okay, so when we fill that in, it's going to look like this. Okay, that's the rhomboid major. All right, and then the next muscle we're going to look at is the rhomboid minor. Okay, the rhomboid minor is also going to insert onto the medial border of the scapula, and it's going to insert on the vertebra directly superior to the ones that the major was attaching to. So this is going to attach to the spinous processes of C7 and T1. All right, so it's two of them. And the way I usually remember this when I was studying this as a student is that the rhomboid minor was essentially attaching to the last cervical vertebra and the first thoracic vertebra. Okay, and then the rhomboid major was attaching to the other four, the adjacent four from there. Okay, now one thing I want to point out, so let's fill that in. Boom, right there. That's the rhomboid minor with the rhomboid major ghosted out for us a little bit. So this is the point that I wanted to show you, right? Notice how the rhomboid minor, okay, and the rhomboid major both attaching to the medial border of the scapular spine. However, the root of the scapular spine is essentially the dividing marker between rhomboid minor and rhomboid major. Okay, why is this important? If you are taking a practical exam on cadaveric dissections, what you'll see sometimes that both of these muscles, they have a similar course. They look very similar, and they can look as one just big mass of muscle sometimes. Okay, but understand that the rhomboid minor is the piece of that muscle that is superior to the root of the scapular spine, whereas the rhomboid major is the part that is inferior to the root of the scapular spine. Okay, and that's how you can tell the difference between those two. All right. Next, we're going to talk about the levator scapula. The levator scapula. Briefly before I go there, actions for the rhomboid minor and the rhomboid major. As you can see, based on their position, they're essentially, when they contract, they're going to pull the scapula up into this direction. Okay, they're going to pull the scapula up that way. Let me see if I can draw this out for you guys so you can see in better detail. So it's going to, I don't like that. That's too light. This is going to be better. So it's going to pull it that way, okay? And this one also, it's going to pull it that way, okay? So that's going to be the action for the rhomboid minor and the rhomboid major. And essentially what that is that's a retraction. That's a retraction of the scapula, okay? Now we go to the levator scapula. The levator scapula. The levator scapula is going to be attaching to the superior angle of the scapula, okay? And then from there, it's going to run up. It's going to run up and attach to the transverse processes of cervical vertebrae 1 through 4, okay? So we're not attaching to the spinous processes here. No, we're attaching to the transverse processes, okay? The processes that are on the sides of these vertebrae. Okay, so when you put in the levator scapula, it's going to look like that. Okay, and based on the name, we can see exactly what it does. It elevates the scapula. Okay, and we can appreciate that the muscle vector is going to look something like that. Okay, it's going to go straight up that way, and it's going to pull the scapula up, essentially kind of like a shrug your shoulders kind of movement. Okay, beautiful. Next, we're going to talk about the latissimus dorsi. All right, the latissimus dorsi. Latissimus dorsi is a very large muscle in the lower part of the back. All right, if you've ever been to the gym and you use a machine called a lat pull down, you're working out your latissimus dorsi, or if you're doing pull-ups, you're working out your latissimus dorsi along with some other muscles of the back. Now, very large muscle, and it has a wide array of attachments in the back, right? The wide array of attachments in the back. So it's going to start down here. So it's going to attach onto this iliac crest here, okay? And then the rest of the muscle fibers are going to insert themselves onto the spinous processes of the sacrum and the spinous processes of the lumbar vertebra and the spinous processes of the inferior half of the thoracic vertebra, okay? The inferior half of the thoracic vertebra, and that's delineated over here by T7 through T12, right? So there's 12 thoracic vertebrae in total. The last 6, the inferior 6, 7, 8, 9, 10, 11, 12, those are the ones that latissimus dorsi is attaching to, okay? Along with all of the lumbar spinous processes and the sacral spinous processes. And notice that I put over here via thoracolumbar fascia, okay? There's a very thick, complex piece of tissue that exists on the lower back and also kind of like wraps around the body as a girdle. That's known as the thoracolumbar fascia. You're probably not going to have to know about the thoracolumbar fascia in extreme detail, but just know that it exists and know that the latissimus dorsi is interacting with the thoracolumbar fascia. Okay, and all these things are all attached together down here around the sacrum and the lumbar area. Okay, so from there, this large muscle is going to run up. And it may or may not have some slips that will insert onto this inferior angle of the scapula. That's why I basically just left this. I didn't label that part. It may or may not attach to this inferior angle of the scapula. However, the attachment site that it definitely will attach to is going to be the floor of the intertubercular groove of the humerus. Remember, we've seen this intertubercular groove before in previous videos when we were talking about the teres major and how the teres major was attaching to this inferior angle and then traveled anteriorly to reach the anterior aspect of the humerus, right? From this posterior view, we cannot see the intertubercular groove because it is on the anterior side of that humerus. The latissimus dorsi is also going to run up and insert onto that intertubercular groove, just like the teres major was doing. So the teres major and the latissimus dorsi are kind of like synergistic muscles to each other in that respect. The only difference is that the teres major is applying its force on the scapula because it's attaching to the scapula, whereas the latissimus dorsi is anchored to the whole entire axial skeleton via its attachments to these vertebra and to the sacrum and to the iliac crest. So when that muscle, let's take a look at what that muscle is going to look like when it's in place. It's going to look like this. Okay, so you see all this white over here. That's going to be the part that's going to contribute to the formation of the thoracolumbar fascia. Okay, and the rest of this is all going to be muscle fibers, and they're going to run up to attach onto the intertubercular groove of the humerus. So based on that attachment site, you can see how the latissimus dorsi is in a perfect position to cause adduction of the humerus. Okay, if this humerus were to go out that way, right, this latissimus dorsi is going to pull it back in this way. Okay, it's going to pull it back in this way, and that is going to be the main action of the latissimus dorsi. However, some additional actions, just like the teres major did, it can also slightly rotate the humerus internally. Okay, and in addition to that, because the latissimus dorsi is located on the posterior half of the body, right, and it's running anteriorly to attach to the humerus, it can also grab the humerus and pull it back towards us, right? So that's essentially would be an extension of the humerus at the shoulder, okay, an extension of the humerus, and that's what the latissimus dorsi does. Next, trapezius. Okay, trapezius, another very large muscle. This is covering the upper part of our back now. Okay, so it's going to have also a wider range of attachments on the back. Okay, so we have the latissimus dorsi here in place. The trapezius is essentially going to attach to all of the spinous processes from the cervical vertebra all the way down to the thoracic vertebra, to the last one of T12. So all the cervical vertebra and all the thoracic vertebra spinous processes is where the trapezius is going to attach. It is also going to attach to the first two landmarks that I started this whole video with, the external occipital protuberance and the superior nuchal line. Okay, so it attaches to the cranium. So it goes from cranium, all these spinous processes, all these spinous processes, okay? And then from there, the muscle is then going to form a diamond shape that then goes and inserts itself onto the lateral 1/3 of the clavicle, okay? The lateral 1/3 of the clavicle is going to attach to the acromion process, and it's also going to attach to the scapular spine right here, okay? And so altogether, trapezius is going to insert onto all these things. Let's see what that looks like. Bam, that's what that's going to look like, okay? So, and then you can see that this muscle is going to be lying superficial to the latissimus dorsi, and really the only area where they overlap is going to be in this inferior half of the thoracic vertebra right here, okay? And so based on this positioning, right, so the trapezius had the orientation of the muscle fibers go in 3 different directions, okay? So you're going to have this upper part of the trapezius up here, which is going to have a fiber orientation like so, okay? And then you're going to have this middle part of the trapezius, which is going to have a horizontal fiber direction like so. And then you're going to have this inferior part of the trapezius that's going to have a fiber direction like that, okay? So you can see that this upper part of the trapezius essentially will function to pull the scapula upward, also known as elevation of the scapula, okay? In addition, it can also pull the cranium back, so it can extend your head and your neck, right? In addition to that, the middle part of the trapezius is going to pull the scapula medially, aka retraction of the scapula in the similar way that the rhomboid major and minor did, okay? And then the inferior part of the trapezius, or the lower trapezius, is going to pull the scapula downward. So this is known as depression of the scapula. So you see how the trapezius is in a position where it can move the scapula into 3 different directions. It can pull it up into elevation, it can pull it medially into retraction, and it can also pull it down into depression, okay? And those are all the muscles that you need to know for the back. Gross anatomy is one of the most difficult subjects in the world. Luckily, it doesn't have to be. Anatomy is one of those subjects that needs constant verbal and visual repetition in order to get good at. What better way to reinforce this information than with the scientifically validated method of drawing? Neuroscience has shown us that we retain information better when we physically draw it out. That is why the Gross Anatomy Study Strategy Workbook is designed to walk you through all the layers of the musculoskeletal system, allowing you to draw the muscles into place. This is excellent for reinforcing muscle attachments, bony landmarks, muscle names, and actions. This will save you tons of time from mind-numbing tactics such as repetitive flashcards or passively listening to boring lectures. With this strategy, you can actually begin to enjoy studying again and have a much better way to retrieve the information. Order a copy of the Gross Anatomy Study Strategy today at the link below so you can spend less time being stressed and more time being blessed.